You cannot overdose by touching fentanyl. On this stat episode of The Regimen, we explain what fentanyl is, when it is and isn't dangerous, and discuss a new law in Florida that makes fentanyl exposure a second-degree felony. Hello friends, today is Monday, April 22nd, 2024. Welcome to the Stat Regimen, featuring breaking public health news. My name is Russ Scarpa. I am a 6th and final year doctor of pharmacy student at the University of Rhode Island.
And I'm Jeff Rapper, a clinical professor at the URI College of Pharmacy and the Academic Collaborations Officer at the Rhode Island Department of Health. The opinions expressed in this podcast do not represent the opinions of the United States government, the Rhode Island Department of Health, nor the University of Rhode Island.
So, the term opioid refers to pain-relieving drugs that work by activating opioid receptors in the body. Common opioids include morphine, oxycodone, and heroin, are all made from the poppy plant, which must be farmed in specific climates, then harvested and processed.
Yeah, fentanyl, on the other hand, is an opioid that's entirely synthetic or man-made. It can be manufactured cheaply in labs anywhere in the world, requires no agricultural source. It's also extremely potent, which means small amounts have far more opioid activity than similar amounts of morphine or even heroin.
But this also makes fentanyl an invaluable tool in healthcare, where it's commonly and safely used to treat severe pain. Because fentanyl is more potent, easier to make, and easier to smuggle, it also has virtually replaced heroin and is often used to make counterfeit pills in the illicit drug markets. We'll delve further into the implications of this in a later episode, but the major takeaway is that fentanyl is everywhere, and it is undeniably making the opioid epidemic deadlier.
Yes, and this is why it's so important to have everyone get naloxone and carry it. Naloxone, of course, is an antidote that can be sprayed in the nose or injected into a muscle following an overdose, and absolutely does reverse fentanyl and any other kinds of opioids. We'll link to plenty of resources in the episode description so listeners know how to get free naloxone and even free fentanyl test strips and other harm reduction supplies if they live in Rhode Island. When it comes to the opioid crisis, everyone is a first responder.
And speaking of first responders, most police officers carry naloxone now as well, which pivots us into the next segment of our episode, incidental exposure to fentanyl. There have been videos spread across social media of police officers encountering powdery substances, which legitimately could be fentanyl, during traffic stops and reporting racing hearts, trouble breathing, dizziness, and sometimes even collapsing on video. Oftentimes they're administered naloxone and usually recover shortly thereafter.
And while I think it's very important that police have naloxone and respond to true overdoses, what we're talking about today is that this kind of social media exposure prompted the state of Florida to pass a law recently that says if a first responder experiences any toxic effects attributed to fentanyl exposure, the person responsible can now be charged with a second-degree felony. Now, this law doesn't require any sort of toxicology confirmation to see if there actually is fentanyl in the officer's blood or urine that leads to these alleged toxic effects.
And that's where this starts to unravel. Because here's the thing. As powerful as fentanyl is once it's in the body, it's physically impossible to absorb fentanyl powder without smoking, snorting, eating, or injecting it. If you could absorb fentanyl by touch, no one would really bother to inject it.
Yeah, and we even talk about fentanyl patches are technological, successes in terms of getting fentanyl slowly released into the body to relieve pain.
And even then, it takes 12 hours.
So, again, I know it's been on my hands before when I've made fentanyl bags, but we're going to talk about how we got to this point. So these reports of fentanyl exposure leading to overdose, incidental exposure, I should say, touching it, the Drug Enforcement Administration, or DEA, has warned police officers that touching small amounts of fentanyl can lead to an overdose. Now, on the other hand, the American College of Medical Toxicologists, which is a national group of physicians who are experts, they put out a statement insisting that, quote, the risk of clinically significant exposure to emergency responders is extremely low, unquote. They go on to say that, quote, to date, we have not seen reports of signs or symptoms consistent with opioid toxicities from incidental contact with opioids. Now, although the statement was released nearly 7 years ago, the science and the evidence base remains strong. Touching fentanyl is safe.
But what about breathing in fentanyl powder if it's spread into the air?
Right, so it's a powder. We're concerned about these kinds of things, but outside of intentionally snorting fentanyl, concentrated off of a service or smoking it, it's incredibly unlikely to breathe in any meaningful amount. So remember, when we talk about toxicology, the dose is the poison here. Any meaningful amount of fentanyl powder floating in the environment. At the highest levels of fentanyl that do get in the air is factories where it's made, and it would take over 3 hours to absorb a dose without wearing a mask. So people who distribute unregulated fentanyl do not wear masks, nor do pharmacists and nurses who make and administer fentanyl infusions in a hospital, by the way.
Right, and following this report and other varieties of outcry from experts, the DEA has since then reversed their warnings and now on their website advised that casual contact with fentanyl is unlikely to have negative effects. So what's going on in these videos then?
Well, these are mostly panic attacks. I mean, they're in high-stress situations. They're being exposed to potentially violence or violent people. One of the things that we look at is that these symptoms of panic attacks aren't consistent with the gradual sleepiness or respiratory depression you'd see with an opioid overdose and are far more likely a stress response. Dr. Ryan Marino, a board-certified physician and toxicologist from Cleveland, Ohio, has done a lot of work debunking these reports on social media and in writings and in peer-reviewed articles, writing in one recent paper that if I told you day in and day out if you were near fentanyl, if you touch fentanyl by accident, you're going to overdose, you're going to die, then the second you come into contact with something that you think is fentanyl or you confirm is fentanyl, that's going to cause a very severe panic reaction.
Right, and along the same lines, Dr. Brian Del Pozo, a former police chief and now a researcher at Brown University, has said, imagine being a cop and believing that at any time I go near these people, I could just die. That is an incredibly needless source of stress. That's his direct quote. But now this new law is perpetuating that myth, which might also make people scared to administer naloxone in an overdose scenario, even though there is no real risk. And that is doing a lot of harm.
Right. People have panic attacks when they see someone overdose, and most likely it's someone they know. So it's very important that they're not afraid of strangers. Again, everyone's a first responder, so it's important that when you have naloxone, you administer it.
Right, and notably, there have been studies showing that brief education is really effective in reassuring first responders on this subject. And that's where our listeners come in. You could definitely share this accurate information whenever you can to whoever you can.
Yeah, and since this has now reached the legislative level, it's really important that all our listeners make sure that they're aware of when these bills come up in their legislators. Everyone can provide public testimony, either written forms or verbal forms. And again, talk about how you carry naloxone, what you're willing to do, why you think you're a first responder, and show that your belief that is true, that touching fentanyl is not a problem. If fentanyl is on a person who needs help, that's what we're here to do. We're here to focus our legislative efforts on response and recovery.
And that concludes our stat episode of the Regimen for Fentanyl Facts. Please let us know what questions you have. Follow us on Instagram and Twitter at PharmDPubHealth. And of course, leave a positive rating and subscribe for more if you found this helpful. We'll see you next Tuesday when we discuss Stop the Bleed, a campaign by the U.S. Department of Defense and the American College of Surgeons to make tourniquets and trauma care as ubiquitous as CPR.